We're now moving to the session Supported Employment in the Continuum of Care. And NASMHPD has been rethinking supported employment as essential to mental health recovery. When individuals have a job, they feel a sense of purpose. We are thinking of this important intervention as we implement along the continuum of care and more upstream and waiting until someone is severely disabled to be eligible. As states establish 988 in crisis services, we are thinking about post-crisis and preventing crisis. Supported employment is one of the pillars, along with housing, that helps keep people stable in the community and out of crisis. This session addresses innovations of supported employment and includes one of the co-founders of the individual placement support model of supported employment and supported employment leaders from the state of Tennessee, which thinks about supported employment in a more progressive way and has a strong relationship between mental health and vocational rehabilitation, something NASMHPD and our partners strongly encourage. I'll now introduce the panelists. I'm delighted to introduce Dr. Robert Drake, who is the co-developer of the Individual Placement and Support IPS Model of Supported Employment. He is also a professor, Andrew Thomson Professor of Health Policy and Clinical Practice at the Geisel School of Medicine at Dartmouth College, Hanover, New Hampshire. And also, I'd like to introduce Mark Liverman, who is the Director of Wellness and Employment for the Department of Mental Health and Substance Abuse Services for the Department of Human Services for the state of Tennessee. And his counterpart, Mandy Johnson, Assistant Commissioner with the Division of Rehabilitation Services for the Department of Human Services of the state of Tennessee. Thank you so much for being here today. The session is just key in terms of a mental health intervention for people with mental illness. I'm going to turn this over to Dr. Robert Drake. Thank you.
Thanks very much, Meighan. I appreciate it. It's a pleasure that to be here with NASMHPD again, and I appreciate you and Brian inviting me, and I'm appreciate being able to share this session with Mark and Mandy very much. I just want to make a few points, but why don't we go through the slides, and I hope they'll come out. Can I advance them here, or is somebody else advancing them?
Dr. Drake, Anthony on our staff is advancing them, so just let him know next slide.
Okay, next slide. Okay, so individual placement and support is an evidence-based model of support employment for people with serious mental health conditions. The intervention helps people to find and succeed in regular jobs that they choose. And it's been a remarkable service, and I think it's relevant here, especially because, you know, crisis services are fantastic, and people are going to go into crisis. And I totally applaud the work that NASMHPD and others have done in terms of trying to develop more humane crisis services. I've been answering crises myself in various mental health programs for about 50 years. And it's really appalling, you know, how weak we are in terms of responding to crises. But I want to make the strong point that, you know, the best treatment for crises is always prevention. You know, think about seat belts and how efficient and cheap that is compared to treating all the head injuries when people bang into their windshields. Think about smoking reduction and how efficient and successful that is, rather than waiting until people have heart attacks and emphysema and trying to treat those conditions. And think about all the vaccinations and what a tremendous job they've done over history with preventing the crises related to terrible, terrible diseases. And much of the mortality and morbidity that we're faced with now in COVID could have been prevented, as everyone from the CDC to the rest of government keeps pointing out. Could I go to the next slide, please? So IPS supported employment is based on a few principles, and these all revolve around paying attention to the individual's preferences for a job. People want to work in a regular job. They don't want to work in a sheltered workshop, and so we try to do that. And people are looking for competitive employment. They want to get a job rapidly rather than go through training programs and so on. Well, so we do targeted job development. We pay attention to the client's preferences. We try to individualize the long-term supports based on their preferences, and we try to integrate employment with treatment. And we make sure that people have good benefits counseling so they know exactly what's going to happen to their benefits, before they go to work. Go ahead, the next slide. There are now 28 randomized controlled trials that support this intervention. And I do want to make the strong point, I just have loved the talks I've heard so far today, but I want to make the strong point that historically, at least in the 50 years I've been in the field, much of our innovations and much of what we've done in mental health has turned out to be ineffective or even harmful. And so it's terribly important that we keep collecting data and we keep trying to do rigorous research to make sure that we can keep shifting towards interventions that are effective and spend our money wisely. As far as employment goes, when we got into the field, the three popular models in the field, which were psychotherapy model, a jobs training model, and a jobs practicing model, all turned out to be completely ineffective when we subjected them to research. And a different model, supported employment, which actually came from developmental disabilities, was much, much more effective than any of those approaches that were widely implemented around the country. And we've also found over time that employment, once people are employed, it has tremendous impact, on all of the social determinants of mental health and mental health crises. So, once people are employed, they've got a secure income. We help them stay connected with mental health service use. Employment helps them to increase their self-esteem, their quality of life, their community integration, their social network. We've showed shifts from having their best friends all be mental health employees to having friends in the community. So, community integration is a big part of recovery. If we could go to the next slide. Oh, there are 28 randomized controlled trials now of IPS supported employment. I won't belabor them. I hope that you folks are interested will read this literature and make sure that these services are more widely available in your community. Can we go to the next slide? One important thing about IPS supported employment is that all groups do better in IPS. Rural people, urban people, people with different diagnoses, people with different symptoms, people are homeless, people who are involved in the criminal justice system, and so on. Next slide, please. And supported employment is now expanding rapidly to new populations. And these are some of the ones that are being studied carefully. People with PTSD, common mental disorders like anxiety and depression, people who are recent immigrants to the country, and so on and so on. The next slide. I think that IPS is effective because it responds directly to what consumers want. Debbie Becker, who really developed this intervention, came up with every principle of the intervention based on interviewing lots of consumers about what they wanted. And as we studied these individual components, it seems like the consumers were always ahead of the professionals. That is, what consumers said they wanted always proved to be more effective than what the experts recommended that they get in terms of services. So the research undergirding of the intervention has, I think, really helped it to move forward. We've had lots of support from foundations and government, and there's now an international learning community because, IPS has become the lead intervention in 26 states, but also in 20 other countries outside of the US. So, we're really thrilled to be part of this expansion around the world. Next slide, please. The IPS Learning Community provides lots of resources to the states and countries that are involved in this. I don't think I want to go into all of them, but, we are now working with a number of states through the Department of Labor to help them integrate leadership at the state level in order to implement effective employment interventions. Next slide, please. The learning community around this country and around the world is really unique in the sense that, it's a two-tiered leadership. We really try to link with the federal agencies with state agencies, and we try to link the state agencies with data and feedback directly from the local sites and from people receiving these services. At the IPS Center, the group tries to provide education, training, technical assistance, and makes training videos and learning community supports of various kinds available. Next slide. This just shows that since 2001, when the learning community started, the states that have been involved in this, which have expanded rapidly, have been able to maintain a competitive employment rate of over 40% per quarter. So over the course of a year, that's more like 60 to 80%, but in each quarter, it's over 40%. Next slide. Let's see, there are also stakeholder committees across the learning community that help states at all the different levels. People who are involved in the system like to learn from their peers rather than from experts. And so we try to provide the opportunity for them to do so. Next slide. There are lots of innovations in the IPS Center, and we try to keep those going, especially the online courses, the certification, the fidelity measures, and so on. And next slide. Okay, and you can find lots of information about IPS and about all the training materials and about the courses that are available online and so on at the IPS Works website, which is listed here. And finally, I just want to say, as a mental health researcher, which I've been doing now for 5 decades, I really believe that, we in mental health have failed to pay sufficient attention to the social determinants of mental health, which, like as with other chronic diseases, social determinants are vastly more important than any treatment that we provide. They help people to make a better adjustment in life, they help them to have a meaningful life, and they help to prevent crises. And I'm hopeful that the field will continue to move in this direction. I really believe that employment is the best treatment that we have in mental health, and for certain, employment is the best prevention intervention we have to help people stay out of mental health crises. I'll stop at this point and turn it over to my Tennessee colleagues. Thank you very much.
Thank you, Dr. Drake. I know you don't like to be called that. You prefer to be called Bob, so I appreciate
Thank
sharing
you.
this time with you and my colleague, Mandy Johnson. Hopefully you will find during this presentation that we not only approach IPS collaboratively, but we definitely consider both the Department of Mental Health and Substance Abuse Services and the Division of Vocational Rehabilitation in all the work that we do across the state with the IPS community. I just want to thank NASMHPD for the opportunity to present today. I appreciate and am a genuine fan of Bob and the IPS Employment Center, so I appreciate presenting with him. And Mandy and I are in more meetings together than I think we are separately. So you'll find that during the slide presentation as we go through each slide. Next slide. So how did Tennessee get started? You'll see this throughout the presentation, and it's one word: collaboration. I would say that a key word within the IPS community is relationship. So the direct care person or the IPS employment specialist builds a relationship with the consumer or the client who's searching for work. They build a relationship with the employer so that the person can find work, and they maintain the relationship with the natural supports of the person that is working. So a key word for us in Tennessee, and I would say probably across the IPS community, is relationship. And that's exactly what started the IPS community in Tennessee. Next slide. So Mandy, you want to talk about DHS VR, and I'll talk about our relationship.
Sure. Thanks, Mark. And I certainly echo Mark's comments. I think a hallmark of our relationship in Tennessee and the success that we have is truly about that collaboration. And here in Tennessee, the IPS model really does embody that collaboration in that it includes the Department of Mental Health, the vocational rehabilitation program, and our community partners, or what VR likes to call our community rehabilitation providers. The Department of Mental Health really is the subject matter experts and lead for us in the state of Tennessee. And they provide the funding and support for the IPS trainers, the salaries for the employment specialists, and really, again, take that lead agency role within the state of Tennessee. For VR, our relationship is really centered on funding and support related to the employment outcomes for the individuals that we are supporting through IPS. And those community partners or community rehabilitation providers, they're the ones that employ the employment specialists and provide the IPS supported employment services and the ongoing supports for individuals. Is there more that you would add to that, Mark?
No, I would just say that, obviously VR and the Department of Mental Health have different ways of working, and that collaboration between our two departments is essential to making the IPS model successful in the state. Next slide, and we'll look at how many agencies we have here in a few minutes. Well, Tennessee began promoting IPS as a model in October of 2013. There were 4 agencies at the time. They're listed on the screen: Frontier Health, Helen Ross McNabb, Ridgeview, and Park Center in Nashville. We started with those 4 sites as pilot agencies, and now there are 21 different IPS teams across the state. It was a joint venture between the Department of Mental Health and Substance Abuse Services and the Department of Human Services Division of Vocational Rehabilitation. And that continued funding and support to make sure that IPS is successful in the state is still in place. I would say that there's 3 entities in the leadership team for the IPS community in Tennessee, and that is the 2 departments that I just mentioned, VR and mental health, and also the IPS trainer team. Although they're funded through my office they definitely are a separate entity because they work very collaboratively and closely with the IPS teams across the state. Mandy, did you want to talk about the closures or how that's a goal of VR?
Sure, I can talk just a little bit about that. So within vocational rehabilitation, one of the outcome measures that we are measured against through our grant funding is the successful employment closure or the successful employment outcome. And that is defined within vocational rehabilitation as an individual who has been successfully employed for 90 days or more. So they've obtained that job and stayed in that job for 90 days. And so we don't consider an individual a successful employment closure until 90 days. And so that is a big part of how we measure success within vocational rehabilitation is that 90-day mark. And I think it's, it was one of those things that we also had to navigate as part of the IPS partnership. I think initially folks may have been a little reluctant in taking on IPS and IPS caseloads and being concerned about being able to achieve that 90-day threshold. And as you'll see in some of the data that we show later, that concern was unfounded. And we really continue to see a lot of success with our IPS cases within vocational rehabilitation.
Okay. Next slide. So as I said earlier, we started in 2013 with 4 sites and 1 trainer. And to date, we have 14 agencies, 14 mental health agencies across the state who employ 21 different IPS teams. There are now 3 IPS trainers, and over the past 8 years, we've supported 4,500 people with an employment goal. And next slide. So there's some links on here. I don't know if they will play, Meighan, or I think it's Andy that's doing the, okay. You can skip that one. Why don't we just go straight to the success stories? And we'll see if one of those plays. And if not, Meighan, you can feel free to share this slide deck with the group and you all can access it, when you have an opportunity. But the webpage obviously links people to the ipsworks.org webpage, which is, as Dr. Drake spoke earlier, where you can find a lot of research and resources about the IPS model. There are several success stories on the webpage, the Tennessee webpage, that talks about, has the client talk about how they were successful at work or how they're being successful at work. And that's important because success builds success. When you have folks that are talking about work and talking about how successful they are at work, then other people are interested in work. And then that last bulleted item is just a very short video that talks about how IPS works in the state. So next slide. So as I mentioned, I can't remember if I mentioned this or not, but IPS is currently in 37 counties in Tennessee. There are 95 counties in the state, and 27 of them are rural. And our governor, who was recently elected, when he first began office, had a emphasis on the rural community. And Mandy, I'll let you speak to that.
Yes, thanks, Mark. So definitely Governor Lee's focus has been on the rural and economically distressed counties within Tennessee. And so this map shows you the different locations where the IPS teams are located across the state of Tennessee. Each one is outlined in a different color here. But the thing that we just wanted to also point out here is that I think Mark stated, of the 37 counties that we're in, 27 of them are rural. And if you break that down even further, 3 of them are what is considered to be an economically distressed county, and 12 are at risk of being a distressed county. So we really have a good distribution of IPS across the state and across both metropolitan areas like Davidson County there in the center of the state, which is where our state capital is, and Shelby County there on the western end of the state, which is Memphis. So you've got those urban areas, but then we also have some of the rural areas of the state where these distressed and at-risk counties that are also participating in IPS. So that upper northeast corner outlined in purple has several at-risk and one distressed county. And same with that kind of darker purplish blue there towards the northern, slightly middle area of Tennessee. So great distribution across the state and really diversity in the counties in which we're represented. Next slide.
And Meighan, I want to make sure that we are sensitive to time. So I'm not sure how much time we have left. Could you remind me?
You are doing great. You have about 5 minutes.
Awesome. Okay.
Yeah.
So IPS is in all of the 7 VR regions and in all of the 9 Department of Mental Health and Substance Abuse regions. There are several types of teams, IPS teams in the community. FEPI, which is First Episode Psychosis, is a youth and young adult focused initiative. Healthy Transitions, and then Clinical High Risk for Psychosis are all youth and young adult focused, serving ages between 16 and 35. So there are IPS team members on those teams, and they focus not only on supported employment, but also supported education. IPS promotes that as well. Juvenile justice reform, I heard a presenter talk about that earlier. We have an IPS team member on a couple of those teams, and we obviously are part of the IPS Learning Community. Next slide. So fidelity. IPS is a fidelity-driven model. So the IPS trainers lead the fidelity reviews. All agencies that use the model are subject to a fidelity review. They think of it as an audit, but really we're just wanting to ensure that they are following the model to the way it was designed. And so those reviews happen at least annually or every 6 months until the agency is in good fidelity. Next slide. So let's talk about the numbers. So last year, I'm sorry, next slide. Last fiscal year, and our fiscal year runs from July 1st to June 30th of each year. And so we served 1,096 people in the IPS community. 500 of those folks worked at least one day, and 223 worked 90 days or more. So that gives us a placement rate of around 46%, a retention rate as measured by the 90 days or more of 45%. The average wage earned per hour for all IPS teams or IPS clients was $10.84, and the average hours worked was 30.5 hours a week. Next slide.
I can speak to this slide. The data on this slide represents a subset of the numbers that Mark just shared. And so these numbers represent individuals who are participating in IPS who were also participants within the vocational rehabilitation program. So as you can see, the VR is a large percentage of IPS customers and makes up about 84% of the individuals who are participating in IPS are also participating in vocational rehabilitation. If you look at that, what that looks like overall in terms of the numbers of individuals that we're serving within vocational rehabilitation, that makes up about 12% of the annual individuals that we are serving. And the 180 individuals who worked 90 days or more make up over 13% of our state's successful closures. So again, that closure mark that we talked about at the beginning, individuals working more than 90 days. So our IPS participants are actually making up a larger percentage of our successful closures than they make up of our overall population of participants in the program. And so you can see from this slide as well, we have a 47% attainment rate, and that hourly wage is $10.45 an hour, and the individuals are working just under 30 hours a week. Next.
Okay. Thank you, Mandy. Next slide. So I'll run through these two last slides pretty quickly. We are running a number of pilots to explore using IPS with other populations. Some of those pilots include TANF, SNAP, focusing on folks that have a dual diagnosis of a mental health and a developmental disability. We're now beginning to work on a pilot for the sensory population, folks that are deaf, blind, and hard of hearing, and also working with the Department of Labor to developing a pilot where they will fund the support to distressed counties. Next slide. Mandy and I work, as I mentioned earlier, collaboratively on a number of bodies, and you can see on this slide some of those groups that we participate in together. We have been in more Zoom meetings over the past year and a half than I want to count. But if we weren't, participating by Zoom, we'd be meeting in person together. And then the next slide. So this is some future goals of ours. We're going to hopefully expand IPS through the VR's 4-to-1 match program. We're still exploring the notion of using Medicaid to fund IPS, working with the Department of Corrections for juvenile justice involvement. And how do we maintain this relationship? I would say we just communicate. When there are barriers, we talk about them. And when there are differences in approaches, we work through those issues. And the fact that the Assistant Commissioner of VR is on this call and our commissioner supports this model is evident of how the leadership top down supports IPS and its expansion across the state. Mandy, would you have anything to add to that?
I just wholeheartedly agree. I think we have a great partnership and certainly is something that's really reflected, I did go even beyond from the governor's office down. I mean, the expectation is that state agencies work together to serve Tennesseans, and we can't do that if we all stay in our own buildings or in our own Zoom meetings. We have to cross-pollinate, and we have found quite a bit of success in Tennessee in doing that. And so love working with Mark and working with the Department of Mental Health, and really feel that relationship and all of those different collaborative opportunities that we have together really do benefit the state and the citizens that we're serving.
I completely agree, Mandy. Thank you, Bob and Mandy, for presenting with us today.
Thank you both. Great job.
Thank you so much, Bob and Mark and Mandy. You guys are just stellar examples of how this all works, and you can really hear the passion and collaboration behind your voices too. Just how refreshed. I mean, not everybody can say that about what they do, and it's clear you guys love what you do. So thank you for what you're doing. I also want to remark about Tennessee that how important that leadership is. Mark and Mandy, you were talking about that. Tennessee just has many examples of that leadership and collaboration across agencies, and just want to acknowledge Tennessee for that. Many other states do as well, and really appreciate the work of Tennessee. We do have a few questions. One is, what are the long-term outcomes for competitive employment? Do individuals get a competitive wage beyond just a living wage? Please share any recent data.
Yeah, and we shared data earlier, and Bob, you can speak to this, but specifically in Tennessee, the average wage last year was $10.84 an hour. That is obviously more than a minimum wage. And then they worked about 30.5 hours, a week. Bob, you can speak to the international community.
So I worried about this when we first got into supported employment, but there are now about 5 studies that have followed people for 5, 10, or 15 years. And, you know, the interesting thing about employment is that it seems once people get started on an employment trajectory, they do better over time, even if the services disappear. So, you know, it's unlike anything else we do in mental health. All of our other services, medications and psychotherapy, the effects tend to erode after the treatment ends. But with supported employments, people seem to do better over time. There was a recent follow-up of the mental health treatment study 5 years after the study ended. And employment improved over those 5 years, and the difference between the people who got IPS and the control group got larger and larger each year.
Thank you. Thank you. Piggybacking on that, what is a long-term employment tenure beyond 90 days? Do you have any information on that?
Well, we are collecting data at the department in Tennessee up to 90 days. Now, the expectation is that folks will need support for about a year after they begin working. And then the great thing about IPS is it's driven by the client. So the client determines how long that support is in place. There is no set time period where it ends. VR may disengage after 90 days of employment, but the IPS teams will stay engaged with that client for as long as they need the support. And again, Bob, you can speak nationally, internationally, that is.
Well, I think I just said that, you know, most of the studies go 18 months about that because that's what research funding allows us. But when we've done the long-term follow-up studies, and you know, there've been a couple in other countries and there've been several in the US, the surprising finding is that the employment amount of time that people work increases over time. Employment, once people start to be successful at employment, it reinforces itself.
Mm-hmm.
The other thing I will just add from a vocational rehabilitation perspective is another data point that we collect through vocational rehabilitation is 2 quarters and 4 quarters after they exit the vocational rehabilitation program. And that data is collected through wage data information on the individuals. And that's something that all vocational rehabilitation programs nationally are required to do. Now, we aren't required to link what service that they received to that employment information, but some states may have the capability to do that, and that would be really interesting to begin looking at as states, continue to collect that data 2 quarters and 4 quarters after the individual exits the VR program.
Thank you. One question that NASMHPD has been thinking about, and that is, you know, right now in this time, there appears to be a plethora of jobs for various reasons, and just wondered how Tennessee, or Bob, how you think of this, how supported employment could be an opportunity, or people that are receiving the services through supported employment, an opportunity for those placements.
Well, Bob, I'll let you speak first.
Okay, well, first of all, employment in the learning community has really jumped up in the last quarter because jobs are so available. But secondly, you know, there are lots of people who have not returned to the workforce, who lost jobs during COVID, who haven't been able to, solve their problems related to childcare, who don't want to go back to the jobs they had before, or the jobs disappeared. And so we've been advocating strongly for remote IPS services, that is, services where the IPS worker reaches out to the client and also reaches out to employers by telehealth and tries to do the same job of careful job matching and careful support of the client and the employer over time. And that seems to be successful, but you know, we'd like to get beyond this COVID epidemic, and we'd like to do more studies of remote IPS to see if we can really expand the program to new populations that way.
I'll just add to that. We collect data on a monthly basis from the IPS teams in Tennessee. And what we noticed during the pandemic is employment rate dropped about 5%, you know, during the heavy months of COVID. And I feel funny even saying that, considering the Delta variant, but it dropped about 5%. But what we did find is that retention went up. So when people started working, they tended to keep their jobs. And obviously, you know, the types of job that they were getting were consistent with what jobs were available during the pandemic. But the fact that IPS teams figured out a way to support people virtually, and people still began work, and they still continue to want to work and maintain their jobs, speaks to the success of the model, and speaks to the success, obviously, of the relationship between VR and the Department of Mental Health and the IPS teams who provide the direct support.
Mandy, did you have any thoughts on this one?
I think the only thing I would add is if you do have the opportunity to go back and watch the video from the links that Mark provided, I think the story that we shared there is a great example of an individual who has, you know, a long-term career goal of actually owning his own hair salon, but he's gotten a job working at a local grocery store, and really showing how that job has provided the foundation for his overall wellness and really engagement in his mental health supports that he needs. And really, he sees that as the tool to the larger goal that he has for himself, which is, you know, that next step. And so I think the important thing is that, you know, really looking at employment as a tool and as a way, you know, not that you have to complete your treatment and then go to work, but that the work can become or is part of the success, and that it's part of building towards a future. And so I think that's a big thing. I mean, none of us are in the job that we first started in, right? And so I think that's just an important concept and application. And so for us within vocational rehabilitation and within Tennessee, we've really been focused on supporting individuals where they are and where they are most comfortable in terms of the pandemic. And so if they're a little bit apprehensive about that job right now, okay, let's engage in ways that you are comfortable. Let's do some of these other things and get you ready for when you are comfortable to begin working. And so just maintaining that engagement has been a really big part of the success.
Thank you very much, Bob Greg and Mark and Mandy. Thank you very much for your presentation. I want